Celebrating success. Stories of path-cited impact and lessons learned from Round 1 awardees working to transform Medi-Cal.
Placer's Adult System of Care is a large program within the Health and Human Services Department of Placer County. We offer many different programs, including we are the county behavioral health providers. We contain a number of the social services. So in Placer, our general goal with the CITED Round 1 funding was to transition our whole person care program into a community support and enhanced care management program. And part of that funding was used to support salaries during that transition as we implemented the new service. And we also used the funding to purchase initial licenses for HMIS and point-click care, which is an HIE. And the other thing that we had to do that was a more significant lift for us is we changed our electronic health record in July 2023. So we also had to modify our electronic health record to be able to document for these services.
Arcata House Partnership provides comprehensive services to support Humboldt County's most vulnerable individuals. More than 51,000 meals are provided each year, more than 33,000 bed nights are provided each year, and 800 people are served through outreach with Arcata House Partnership each year. CITED funding enabled Arcata House Partnership to build all the infrastructure necessary to support the work. It allowed Arcata House Partnership to establish office space and equipment for the new program. It afforded us the opportunity to establish the capacity to perform medical billing, and it funded the services of a consultant, me, to design the program and oversee the program rollout.
Since 1888, 5 Acres has served over 100,000 participants and currently cares for over 7,000 children and families annually across 5 counties, including Los Angeles County. The ability of 5 Acres to gather our teams, communicate thoroughly, and increase training and support appears to have helped to mitigate the risk of increased turnover and leaves by our staff. This was only possible due to the investment via PathCited in our infrastructure, systems integration, communication, training, and most importantly, staff capacity to have the bench strength to do this while keeping up regular operations.
I think one of the things that I observed is as being a county behavioral health plan that we normally contract directly with DHCS. And so this was our first time contracting with the managed care plans. And it was new to us and it's new to them and it's different. Thankfully, we're a smaller county. We only had 2 managed care plans, but each managed care plan has slightly different contracts and how they claim and bill. So one thing that we've really had to focus on is how we claim, because we had a lot of claim denials in the beginning. And now we've had to really focus on how we review and rework our claims to make sure that the first time we submit them, that we receive them, the funds.
One of the lessons that we learned early on in the implementation of this program is that community-based organizations in more rural communities like Humboldt County, California, had a real struggle with keeping a trained and qualified workforce to provide that programming. So community health workers was something that there's not an abundance of people with that training in the workforce in that area. So this is what led Arcata House Partnership to pursue additional funding from Partnership Health Plan of California to build an internal community health worker training program to overcome that obstacle.
Some overall lessons learned dealt with factors that were out of our control due to the changing external landscape. 5 Acres continues to remain steadfast in our approach to be proactive rather than reactive. We have navigated a pandemic, economic downturn, and regulation changes to our industry. This has affirmed our approach and investment in using data to drive our decision making.